The key message of this document is that we all possess great dignity. Human life, your life, my life, and our children's lives, they all possess great dignity, not just by virtue of the fact that we're human, but also because we're made in the image and likeness of God Himself. So this document considers human life not just from its natural and earthly perspective, but also from its supernatural and eternal destiny. So it's great because we all know there's more to life than just the here and now, and it takes into account the bigger reality that we're all facing into. Well, first of all, this document, Dignitas Personae, it has something very positive to say about the Church's attitude towards infertility. The Catholic Church is very concerned about couples who suffer from this, and they see it as a real suffering for couples and as a real cross. And traditionally, I think people would look at the Church and say, you're just going to say, no, we want to have a baby, and the Church is standing in the way saying, well, you can't have a baby because there are certain limits and certain boundaries to what are ethically permissible. And what the Church is saying, look, first of all, don't feel judged. The Church isn't judging any person, but it's saying, consider the dignity that you possess, consider the reproductive choices available to you, and make a choice that's in keeping with your dignity as a son and daughter of God. And it's really, I think, challenging people to say, embrace something that's beautiful, something that's good for you, and something that's a dignified way to achieve your desired result, to have a family together with your spouse. This document speaks to couples with infertility, and it says, look, we care about your infertility and we want you to achieve a successful pregnancy, but there are certain boundaries that if you cross these, you're going to be damaged and it's going to be hurtful to you and possibly the children you may wish to conceive. The first principle is, if you're going to pursue fertility treatment, you should be married. For most people, that's common sense, and they can understand and recognize that. And it's simply because children do better when their parents are married. The second principle that it holds to is that whatever fertility treatment you pursue, it must respect all human life, your spouse's life, and any children you may wish to conceive. This means embryonic human life from the moment of conception. It's fully human, and it ought to be respected and treated with the respect and dignity due to all human people. The third principle is that conception must occur through a normal act of intercourse. So these are the three guiding principles. So if you stop and reflect about these principles, this is what most people want. Most people do want to achieve pregnancy naturally, if they can at all. And the Church is saying there is a way that you can do this. So it does mean if you want to make a choice that's in your own best interest, that respects your dignity as a person, your spouse's dignity, and the children you may wish to conceive, then choices like intrauterine insemination, in vitro fertilization, and ICSI are all morally illicit and ought to be avoided by all Catholics, patients and doctors alike. Catholic doctors who work with infertile couples, they want to make the best choices they can for themselves and for the patients that they're trying to treat. And this document gives them clear guiding principles to say, look, if you want to do what's best for your couples coming to you, if you want to do what's best for the children they're trying to conceive, there's a good way that you can achieve the desirable effect of achieving a successful pregnancy without having to do something that's morally questionable. Interestingly, in fact, 2 doctors who trained in vitro fertilization in Poland have actually abandoned the in vitro fertilization techniques in preference of using a new technique called natural procreative technology, or NaPro technology, to help their infertile couples. NaPro technology, it's a new scientific approach to the problem of infertility, developed by consultant obstetrician and gynecologist Professor Thomas Hilgers in the United States. He pioneered this. In fact, he's been working on it for about 30 years, but in the last 10 years, he's made the most significant advances. And essentially what it involves is that couples learn how to track their fertility cycle. They go through a process of detailed hormonal studies, ultrasound studies, and new diagnostic categories are established which empower the doctor to identify and treat new problems that previously escaped detection. Recently, there was a scientific publication in a peer-reviewed medical journal that has shown that NaPro technology is comparable or possibly superior to artificial reproductive technologies. So this is good news for couples with infertility. Now they have a choice that they can make that is in keeping with good conscience, good ethical practice, and it'll get the results they desire. In Ireland, NaPro technology has been available for 10 years now, and in those 10 years, over 140 couples with a history of repeated failed IVF attempts have actually achieved successful pregnancies. So many people would say, well, if I'm going to go for the moral option, this means I'm going to choose a less effective treatment. Well, thankfully, due to NaPro technology, this is not the case anymore. We now have a very good medical science that we can offer people that won't be offensive to their moral viewpoint. My overall reaction to the document, in fact, is a positive one. Now, I'm aware that a large part of the public would actually look at this and say, all I can hear is a list of prohibitions. I can't do artificial insemination. I can't do IVF. I can't do ICSI. I really want a baby. This is challenging to me. And I would say, look, before you rush and make your decision, consider what treatment option is going to respect you, your spouse, and the children you may wish to conceive. Consider what's involved in the process. And for me, it helps if somebody takes a personalistic approach to all of this. We're people and we're in relationship with one another, and some things are so highly personalized, you can't rightly delegate them to somebody else, or it's insulting to them. For example, I'm thankfully married and I have children, and if it's my child's birthday party, and I'm too busy at work and I say to my secretary, look, would you please go to my son's birthday party and give him this gift and tell him Daddy says happy birthday? My child would rightly be offended, and he's not treated in relationship with me, he's not treated with the dignity and respect that's due to him. Similarly, if I ask somebody and say, well, I'm busy, I can't meet my wife tonight, could you take her out for dinner and give her a kiss goodnight for me? It's a personal relationship I'm in with her. So when you come to consider the process of conception, conception is a highly personalized thing between a couple. What in life can be more personal than trying to conceive? So if I can't be present at the moment of conception to try and achieve that with my wife, then if not me, who can do it in a way that respects her and respects the children we wish to conceive? And this document says, you're persons, you're in relationship, you have to be present for the conception of your child. If you can't be present, then it shouldn't happen.